was a trial in which we validated a multimodal artificial intelligence test, the Artera AI breast test, in patients with ER positive or estrogen receptor positive, hormone positive, node positive breast cancer. And really the purpose of this study was to identify patients for whom chemotherapy provided the most benefit. We know that in patients with node positive disease, there's heterogeneous benefit with chemotherapy in these patients. We really wanted to identify the patients that derive the most benefit from treatment in an effort to identify patients for whom treatment de-escalation might be appropriate. That is, patients with 1 to 3 nodes positive, for example, might not need chemotherapy. How do we identify the patients that are going to benefit from it from those that are not? And that was the purpose of the study. And so this test had previously been validated for prognosis in the ABCSG8 breast trial. It had validated for chemotherapy benefit in the NSABP B20 trial in women with node-negative breast cancer. This was an extension of that study into women with higher risk node-positive breast cancer, again, trying to answer that question of who benefits from chemotherapy and who does not. So with that locked model, in the MMAI model, we then asked the question, can we identify patients at low risk of recurrence at 5 and 10 years with disease-free survival and overall survival? And we were able to show that in the MMAI low-risk group, they had no benefit from chemotherapy and are appropriately candidates for de-escalation of therapy. In the MMAI high-risk or non-low-risk group, those were the patients that were deriving the most benefit from chemotherapy in the 8814 trial. And therefore, we can potentially use MMAI as a risk stratifier, not just for prognosis, but also benefit from chemotherapy in that patient population.